Hello, and welcome back to Over the Next Hill Fitness podcast. I'm Carla Coffey, your coach and host for the program. You can follow me on all the socials under Coffee Crew Coaching. You can reach out to me if you have any questions or if you'd like to be on the show, carla@coffeecrewcoaching.com. If you're looking for a coach, fitness coach, running coach, same thing. You can email me there at carla@coffeecrewcoaching.com. Today, we're going to be talking to Renee McGregor. She is a dietitian from the UK, and we're going to be discussing some very life-changing information. So I hope that you'll enjoy the recording. And if you have any questions or would like to reach out to either of us, please email me, and we will see what we can do to help you. So let's listen in. Hi, Renee. Thank you for being on the show.
Thank you for having me, Carla. I am looking forward to our chat.
Awesome. So am I. So could you tell the audience a little bit about you and what you do before I get into all my questions?
Of course, yeah. I am what you would call a sports, exercise and medicine dietitian. So I work in the field of sport predominantly. But I guess I have become known as somebody who has a very good knowledge and experience in working in REDs and eating disorders and just general kind of complicated presentations, I suppose, within sport around training and food and body. But that's not to say I don't also work with people who are just looking for a performance outcome. I do a bit of everything. And I'm also an author. So I have 6 books and I do a lot of writing. I have a regular column in Runner's World in the UK. And I also have recently started my own Substack, which I'm really enjoying, I have to say. Yeah, that's me.
Okay. And we'll put all the links to all the things in the show notes for the listeners too.
Great.
So the reason I wanted to have you on today was to talk about REDs and some of the other things. I know for my podcast in particular, a lot of the listeners are runners and a lot of them are women and a lot of them are long distance runners. So what can you tell us about REDs and like what they can look for symptoms and things?
Sure. So REDS stands for Relative Energy Deficiency in Sport. But if I'm honest, I actually sometimes prefer the term Relative Energy Deficiency Syndrome because that's kind of what you're defining, right? So REDS is a presentation and it happens based on a lot of different things, but it's underpinned by low energy availability. So low energy availability is when there's not sufficient energy being consumed to support biological processes. So that's like, your heart, your brain, your lungs, your endocrine function, your circulatory system, basically just being human, but also support training and movement. And that it does include like daily movement. So, it's not just about going for a run. It's like if you're walking your dogs or if you're taking your kids to school or you commute to work, like all of this counts as movement. And what happens is that the body will always prioritize energy for movement. That's kind of how we've evolved from our hunter-gatherer ancestors. And so it will always find somehow the ability to be able to find the energy to go and to move. But actually, as a consequence of that, it will start to downregulate and sort of switch off, I suppose, what it thinks as non-essential functions for the body at that moment in time. So things like our reproductive system can get shut down, and then slowly other things like our immune system, our bone health, our kind of pulmonary system. So everything can get shut down. So the thing about REDS is that there's no one fit presentation. You can't say, oh, okay, if I've got REDS, I'll have this, this, and this. You might only have one symptom, you may have 5 symptoms, and so it's what we do is it's called a diagnosis by exclusion. So you have to look at a number of different factors. The other thing about REDS is that although I said it's underpinned by low energy availability, there are other contributing factors. So for example, under recovery. So, like when we think about a lot of recreational runners, and I'm definitely put myself in that category as well, but who are also working full time, maybe mothers, maybe have other kind of caring commitments, and they're trying to also train. And let's face it, everybody's trying to train like an athlete these days. No one's just happy to just go for a run. Like everybody's got a training plan, or everybody's got a coach, or everybody's got, like a performance goal that they're working towards. And I guess what can happen is when time is squeezed and you don't give your body sufficient time to recover, whether that's between competitive races or whether that's just day to day, then again, that also generates stress within the body. And this stress is sort of seen by the central nervous system as threat. And again, what it does is when it kind of identifies threat in the body, it will start to once again downregulate the body's biological systems. And so what we see in REDS is fundamentally a process of downregulation, in that the individual, like I said, can present in so many different ways. They can present with menstrual dysfunction. So it might be that, their menstrual cycle changes over time and then eventually just completely stops. They might present with digestive changes. So, we see this like increased gut permeability as a result of not having enough energy for digestion to occur. And also when we deplete our bodies too much, we kind of lose the lining around our gut and around our stomach. So again, that increases that gut permeability when we run. We might see a lot of bone stress injuries or full-on stress fractures. So a lot of kind of, and then in addition to that, maybe some niggles around kind of connective tissue. And you might see psychological changes, so mood changes, higher anxiety. So you can see like it's the list is actually extensive, and it depends on which system in the body has been impacted. And I guess that's the thing, is that it's different for everybody. I will never see two people that present with the same symptoms. You might see similarities, but they'll be different. And the other thing to say is that REDS can be intentional and it can be unintentional. So unintentional is when an individual might not appreciate just how much they need to fuel. And I think this is very common. And I see this with a lot of women in particular. I don't think society and social media helps in kind of informing us and how we should be and how we should eat. Mm-hmm. But it can also be what we call intentional REDS, which is as a consequence of a more complicated condition. So that might be disordered eating, an eating disorder, or exercise dependency. So, they're both complicated. They both take a long time to recover from, but one probably has more, probably needs a little bit longer to kind of recover from fully, because there's often that psychological element associated with it.
Okay. So is REDS gender specific?
No, it can affect anyone. And I think that's the thing, like initially what we were describing was the female athlete triad, which I think everybody became very familiar with, that in women, their training load impacted their menstrual function, which then affected their bone health. And so they would have this very high prevalence of bone stress injuries. But we only saw these like 3 points, hence the triad. But actually once when they started to appreciate that actually the same physiological decline can happen in men, and it's not just related to 3 parts of the process, it's much more widespread. And hence why in 2014 the IOC put together a consensus statement around REDS and what it was, and the fact that it can affect both men and women, and also any level of athlete. So although I think people assume it's a higher prevalence in the elite and professional world. I would actually say we see a lot of individuals in the recreational world. And I think there was a study recently that said that the prevalence of low energy availability was somewhere between 43 and 72% in recreational athletes. So again, if we say that low energy availability underpins REDS, then you kind of can see that it's really quite a big problem.
Mm-hmm. So at what point do you, I don't know if this is the right way to say this, but do you diagnose that it's REDS rather than, oh, they just have an injury? Is it having more than two symptoms? Is that how you diagnose that?
It's a really good question. I mean, generally speaking, what we'll do is a full assessment. So we'll look at kind of behaviors and sort of relationships with food and body and training, but also look at blood test results. So we'll be looking at kind of metabolic markers, we'll be looking at stress markers, reproductive markers, immune markers, and that gives you a pretty decent indicator of what someone is going through. So I think you can, with somebody who is qualified, you can definitely sort of do this full assessment. You take a very long history, and then you can kind of say, yeah, okay, this individual is probably in REDS. So hypothalamic amenorrhea when menstruation stops is a potential sign. It might not be REDS, but it's definitely a potential sign that something is off and needs to be investigated further.
Mm-hmm. I think we used to always just think of a person as being overtrained, but this is actually a step beyond that. Would you?
Yeah,
agree with that?
I think, yeah, I would say I would definitely think there's an overlap with overtraining. I think we cannot ignore the fact that insufficient rest will also generate some of these presentations. So, I've had somebody just today who actually, when you look at her metabolic markers and did like a history of her nutrition, actually she was eating quite well, but actually her stress markers were super high. And when you're looking at her training load, it was way too much. But also she's a junior doctor, so she's trying to do a lot and hasn't appreciated the stress in her system, and actually that stress is being picked up in the body. And I think that's the thing, is like people often don't appreciate that our bodies are very, very clever. The whole point of having a central nervous system is that it is monitoring for threat, and as soon as we experience a level of stress that is too high for our body to cope with, and that could be physical stress or emotional stress or a combination of the two, then it's going to start setting off alarm bells, and it's going to start kind of saying, oh, hang on a minute, we need to sort this out. But again, because I think of the way we live these days, a lot of us just ignore and think, no, it's fine, we can keep going. And also, how many of us have said, oh, I'm really stressed, I'm going to go for a run? And actually sometimes probably the worst thing you can possibly do, right, is to add another layer of stress on an already stressed out system. So it's quite a complicated process and presentation. And I think people get frustrated. I kind of see individuals that come into clinic and maybe they come in with a stress fracture, or they come in with hypothalamic amenorrhea, and you kind of start going through, okay, well, this is what's going on for you, and this is what we need to do. And I think everybody assumes that if they just correct their eating, then it will all go back to normal. But actually, it's not really that. By that point, it's almost too late to just correct your eating. You've actually got to have a complete shift and modification of all your behaviors. So that might mean, it might mean a reduction in training load. It might mean a reduction in training intensity, depending on what is the presentation, depending on what that person's doing. It might mean eating more. It might mean eating differently. It might mean doing all of those things. It might mean, making sure you're getting more sleep. Like it's not a simple formula. And I think while I welcome the awareness around REDS, and obviously a lot of people and a lot of athletes talking about their own experiences and symptoms and everything else. And like I said, I absolutely welcome people talking about their lived experience. I think we also have to be very, very careful not to simplify it down to, oh yeah, but if you just eat a bit more, it'll be fine, because it's not as simple as that. And every case is very different. And, you know, some cases are more severe than others. All are important, all need to be rectified. But in some cases, if someone has been in a deficit and depleted for a significant period of time, it's going to take a significant period of time for the body to heal. And I think what people find most confusing is that actually in REDS, you don't always lose weight, because the body is down regulating and trying to preserve energy and trying to keep you going, you don't always change from a weight point of view. You might actually even hold on to more body fat, because the body's like, I need to hold on to as much energy as possible. And so I think, again, people can't see the damage that's being done internally, so they don't think it's a problem. So unless you have any signs and cues, you don't do anything about it, which is why I think often when people come and see me in clinic, they've usually actually been in this place of depletion anywhere between, you know, a year to 2 years. And it's quite a long time before you actually start to get severe symptoms. Now, in some cases, you'll get symptoms very, very quickly. And again, it all depends on the kind of the depth to how depleted the individual has got.
Wow. So that's a long time. So I would think that it's also not a quick fix. It's going to take that long or longer to get you back on track.
100%. And I think, again, it's quite, it can be quite a challenging experience working in it, because I think people will go, well, I've been doing everything you've said now for 2 months. And it's like, yeah, it's not going to be that quick. I mean, we know that it takes a minimum of 18 months for the body to fully heal. And then depending on the kind of depletion and depending on the history. So if you've had somebody who's had an eating disorder, you know, even prior, if they've had an eating disorder in their teenage years, maybe they've had a few years of being okay or functional or whatever we want to call it, and then they go back into kind of this more restrictive phase or overtraining phase. You know, we see this a lot, right? We see a lot of individuals that have had an eating disorder as a teenager, they've never really fully recovered, and then they've moved into sport, and that's, they, you know, in their mind that saved them, but actually all they've done is developed an exercise dependency, and the eating disorder and the symptoms around the eating disorder have never really been explored properly or recovered from properly. And so in these cases, I think what I want to highlight is that we also know that the brain and the brain structure changes. So if you were looking at these brains on an MRI, you would actually see changes to the gray and the white matter in the brain. And what we know is that it can take up to 5 years, having restored energy availability. So, you know, we're thinking like 18 months to kind of get back to a place where the body is functioning better and is kind of in a better place, you know, and can work. But then it can be another potentially up to 5 years for that brain structure to change. And so I always think it's really important to give that information out so people don't feel frustrated or angry at themselves that, you know, why is my thinking still like this? Why am I struggling? You know, I've done everything I've said, but I still don't, you know, I still really struggle with how I look or my thoughts or whatever. And obviously, you know, it's important to do therapy alongside, but equally, I think it's important to help them to appreciate that some of it is biological. Like the biological changes that have occurred are going to take time to restore, but they do restore, but it just takes time.
Wow. So you have the patience of that. Is it primarily people like in endurance sports, biking, running, triathletes, or can it be just your average golfer? Do you know what I mean? Is it
Yeah.
always somebody who's really pushing themselves?
It's funny actually. I have actually had a female golfer that has had reds. So it can happen to anyone.
Okay.
Like I definitely I think I've seen it in most sports, including including women's rugby. Like you wouldn't think that, but even in women's rugby, I have seen it. I think it's important to remember that, again, just for clarification, I think a lot of people assume reds is about trying to hit maybe a body composition or kind of fit into an aesthetic that is expected in their given sport, and obviously that might be a driving influence. But I think it's also important to remember that a high percentage of people who show signs of reds actually do have quite a disordered relationship with food. And often the disordered relationship with food is not really about the body. It's about it's a defense mechanism that helps to protect an individual from emotions that they're unwilling to feel, right? So I think this is why it can present in any sport, because you think about the personality traits of people who are involved in sport, and I'm not talking necessarily about high performance sport, just in sport, full stop. They do tend to be a certain type of personality. They do tend to be, high achievers, perfectionistic, compulsive, critical, sensitive, and these are also the same traits we do see in individuals who have a high prevalence of eating disorders and disordered eating. So, you put that personality type into the right psychosocial space and you generate the perfect storm for dysfunctional behaviors to happen. And I think what I always try and help people to understand is that there's usually a purpose behind that behavior of restriction or overtraining or an inability to stop. There's a purpose there, and usually that purpose is protection from a fear, is protection from, again, like I said, something that they're unwilling to feel. Maybe it's a protection from a fear of being deficient, or a fear of failing, or a fear of rejection, or a fear of, I don't know, not meeting expectations that they've got of themselves. But there is a fear there. There's an inability to be vulnerable and accept that actually, as humans, we often have to experience difficult emotions. And I'm not saying this is all conscious, but I think food and exercise are a really good way of helping people to, I suppose, avoid those difficult emotions. And it's not conscious, but once it happens, you become like, I guess there's that familiarity of, oh, well, when I do this, I feel better. Like if we think about ourselves, we think about running. Whenever you run, you're kind of really, you're in your head, aren't you? You're kind of like, you're not really thinking about some of the other stuff that's going on in your life. It's a way of sort of almost numbing everything for a short period of time. And I'm not saying that that's good or bad, but I think when it becomes something addictive, when it becomes your only coping mechanism, rather than learning other healthier mechanisms that can be more supportive of your health, then that's when it's likely to become dysfunctional. And that's what we have to then be mindful of.
And that's also the things I can control. Is I can control the run, I can control my food, but maybe I can't control what's going on around me. So that's seems to be that's where that happens.
Yeah, it's definitely a false sense of security, though, right? It's a false sense of control, because the reality is you're
Yeah.
not controlling your body, and you're not controlling your food. You're being controlled, right? When we actually control,
Right.
we have choice. We have choice in whether we go for that run or we don't go for that run. We have choice in whether we eat the pizza or we don't eat the pizza. Do you see what I mean? And I think
Yes.
I hear you, and I absolutely agree with you, and it's what I hear in clinic all the time, and I guess it's also what I try and correct people and help them to realize they're not in control. And actually, there's so much of our life we can't be in control of, and this false sense of control, I get it. It kind of creates this sort of neatness, this kind of tidiness. And I think what you're trying to do is avoid chaos. Like some people really struggle in things not being exactly how they need them to be in order for them to move forward. And again, what I always say is that, nothing in life is certain. We have to accept that things can constantly change in the blink of an eye, right? One minute you could be walking down the street and the next minute you could trip over a rock. You don't know what's going to happen. And I think it's important sometimes to bring that just bring that kind of image into mind, that you can't control how someone views you. You can't control who else you might be competing at in that race, in that given moment. You can't control how other people are going to behave. And like, if you restrict your eating or you keep on training really hard, all you're doing is taking yourself further and further and further away from the place you really want to be, because it's just going to deplete you and it's going to make life really quite miserable. And I guess it's trying to get them to appreciate that and see that.
Yeah, I see. So how does REDS compare, or does it not compare? Is it similar to rhabdo? I don't know the long name for rhabdo.
Yeah, rhabdomyolysis. So rhabdo
Yeah.
is, they're kind of potentially linked. They are different things. Rhabdo is fundamentally when your muscles are put under huge amount of stress, and they basically break down, and then that starts to have an effect on the kidneys and the liver, and so you can be in a real mess fundamentally, and it is life-threatening. So it's not specifically related to REDS, but I guess it could be potentially as a consequence if someone, has pushed themselves too hard. It often comes after you've actually had a period of being sedentary and then you decide to go out really hard, or if you're doing a sport for the first time perhaps, and you just decide you're going to go and do something crazy. And I guess that's also why we have to be careful about the anti-inflammatories, the NSAIDs, because that already can start to put your kidneys under pressure. And then obviously if you end up in rhabdo, you put even more pressure on your kidneys. And so again, that can also be problematic. But yeah, I'm trying to think. I think I've not seen rhabdo in clinic necessarily as a consequence of REDS. Maybe once.
Okay.
In the entire time I've worked in it, probably once I've seen it. And we did question if there was something else going on that caused that, as well as the REDS that was happening at the same time.
Okay. That was kind of what I was wondering, is if you can have either, and you don't have to have both.
You definitely don't have to have both. You can have either, and they can be very separate. But absolutely, there is a possibility that if you're in REDS and your body is already compromised, potentially you could end up at slightly higher risk. But I don't want to say that is always the case. I think there's a potential there.
Gotcha. So it's not gender specific, and it's not sport specific. Is it age specific at all, or does that run the whole gamut as well?
Yeah.
It could go anyone, anywhere,
anytime. I guess that the challenge sometimes when we have slightly older women is obviously it can also hit at the same time as perimenopause and menopause, and of course that is something we do have to keep in mind. Like, obviously when women go through the perimenopause or the menopause transition, we know that again, there are a number of symptoms, and the symptoms can actually be very similar to REDS. So you have to be kind of a little bit kind of mindful of that. There are also many, many, many more symptoms with perimenopause than there are with REDS. But I think, it's always more challenging when you're working with somebody in their 40s onwards, because you kind of have to work out what's really going on here. So that's where the history is even more important to kind of truly understand what's happening. And the problem with the perimenopause is that obviously we can't. There's no test. There's no like blood test, because obviously during the perimenopause your hormones are fluctuating so much that at any given time it could be anything. And so that's hence why you feel like you're on this incredible journey of unpredictability, because you just don't know how you're going to feel. It'll be different every single day, because that's exactly what your hormones are doing. But what I will say, some of the similarities are obviously in REDS, it can be very common for women to have low estrogen levels. And obviously in perimenopause, it can be very common for women to have fluctuating estrogen levels and then eventually have very low estrogen levels. And so, again, like I said, sometimes you have to just listen a bit more. Maybe you have to try different things. So often what we find is that one thing is you could suggest that a woman starts hormone replacement therapy and goes on HRT. And actually, what we do know is that if they are in REDS, then they won't feel a significant improvement in how they're feeling, because the low energy availability, the overall stress in the system is not going to be counteracted by taking HRT. Whereas obviously if it is perimenopause and we know that the symptoms are related to these fluctuating hormones and you kind of even out this estrogen, then often the symptoms improve. Even if it's temporarily, they definitely improve. And so you can be like, okay, and especially if energy levels improve and performance improves and you just start to feel a bit better, then you can think, okay, well, this was straight perimenopause. But what I will say, you can have both. In this case, you can have both. You can have perimenopause and you can have REDS at the same time. And we do see this a lot. And it's a tough time. The perimenopause is a time of transition, right? And it's hard because, again, like, your body is unpredictable. It's not doing anything you're asking it to do. You could be somebody that has never had to worry about your body or body size, and suddenly you can feel totally uncomfortable within your body. Even if your body doesn't really change, you can just feel uncomfortable because of the influence of these hormonal changes. And that feeling can then be what triggers behaviors around doing more exercise, eating a bit less. There's also so much noise and information about how perimenopausal women shouldn't eat this and they should do this and they should have this supplement. And so you get caught up in it because you feel so terrible. You just want to feel better. And so we definitely see this a lot. And I guess it's, again, step by step. You probably would start somebody on HRT, but then you would also start to look at their nutritional intake, and you would start to kind of challenge that and kind of make change according to that. So it's not none of it's straightforward, I guess, is what I'm trying to say. And it's hard enough working in it, but being actually living with it's hard. And I want people to acknowledge that I get that it's not a nice place to be, and it's often not a choice. It's just where they've ended up, and then they're a bit stuck and they need support and help.
Mm-hmm. How long has the diagnosis of REDS been around? Is it fairly new? I'm sure it's always been there, but where they said this is what it is and this is what we're looking for.
So I guess it first came into mainstream sports science in 2014. But I would say, I've been a dietitian for over 25 years, and I used to work in the NHS as a clinical dietitian. Actually, my area of speciality before I left the NHS was actually working in adolescent eating disorders, and there's a lot of crossover between what you see in REDS and what you see in eating disorders. So I would say that it's been around for a very long time, but in terms of it being a identifiable situation within the physically active population, probably only since 2014.
Okay. So speaking of eating disorders, I know fasting isn't an eating disorder, but fasting is really on the rise, and especially with women, women in menopause, perimenopause. Is that a bigger trigger? Is that something that, you should, I don't know, be more careful with if you decided to do intermittent fasting or any kind of fasting?
Yeah, I mean,
Does that set you up for that?
yeah, but yeah, I mean, I'm not a big fan of fasting for anyone. I think there's not enough scientific evidence for all the benefits it suggests at all. I think, and actually what we do know is that if you create too big a fasting window and then you're also exercising during that window, you're potentially creating two effects. One is a slightly higher cortisol effect, so your stress hormone is going to remain significantly higher and chronically high, which again, when cortisol is high, it starts to send a message to the hypothalamus to say, okay, hang on, there's stress here, we need to sort this out. But also at the same time, when you create sort of in-day deficits, we know the body doesn't like that either. So again, it tends to again react with that. It's kind of like little stress monitoring, and again, it doesn't really do you any good. So I think, like, from my point of view, there is very little evidence that anybody, particularly who's physically active, should ever do any sort of fasting at all. And in fact, the most recent study that only came out a few months ago demonstrated that they've now found, it was a really big study, they've now found that people who have done fasting, particularly the kind of intermittent fasting with the kind of the window, the sort of 16-8 window, actually have a higher risk of cardiovascular disease than people that didn't. So there's something in fasting, most probably related to the cortisol, that is having a very negative effect on our cardiovascular system, and they've picked up on that. So although yes, it's been pushed and promoted as a way of weight loss or weight maintenance or anti-aging, like there's so many insane reasons for doing it, actually the best study has shown that it's probably really not that great for you at all.
And that would be for either gender or women?
No, that was for both genders.
Yeah.
Yeah. And I also think, like, like the other thing about fasting is that if you're doing intermittent fasting, then I guess you have this window where you do eat, and so and you're kind of being contained, right? That's why people like it, because it's a neat way of containing a time frame that they can eat in, so it kind of gives them rules that they can live by. But the reality is that we need food on a regular basis. It supports our bone health, it supports our replenishment, our recovery. And so particularly if you're exercising in your fasting window and you're not recovering immediately after, then that can have a real detrimental effect on things like your bone health. And obviously, as we get older, that's already a problem for both men and women, right? Is that we start to lose bone density, but also women in particular, as they go through perimenopause, will have a significant drop. But it does affect men as well, the drop. So, I think I always find it really fascinating. Like when I look at studies and academia and people testing certain hypotheses, whatever that is, whether it's about performance, whether it's about body composition, whether it's about some sort of health metric, because they're so fixated on a spotlight on one particular outcome, what they're not doing is looking at how that, that behavior, or testing that hypothesis, what it might be doing to the rest of the body and how that might be affected in a different way. And I think for me, that's I don't know, I find, for me, that's really important. I like to look at the person holistically and look at how all the pieces of the puzzle come together to make this person feel whole and good. And I'm not sure everybody else works in the same way as me, but that's definitely how I like to work. So, if someone says to me, oh, I want to do fasting, then I would, like, in the same way that just, spoken through it with you, Carla, like, I would explain why it wouldn't be a good idea, particularly if we're worried about bone health, or particularly if we're worried about, their adaptation to their running, for example. And so it's helping them to see that we're not as simple as, if you do X, Y is going to happen. Often if you do X, Y might happen, but so will ABC, and they might not be good outcomes
Right.
for you, right? And I think that's really important to realize, that humans are not machines. We are not just like, we're often compared to cars, aren't we? You put fuel in and you go, but we're not cars, because we are living, breathing organisms that are constantly needing energy and constantly needing tending to, and are constantly being monitored. We might not be monitoring ourselves, but we have homeostatic control within us that is monitoring us all the time. And so what we are is, we are an incredible feat of engineering, because our body keeps going, it keeps working for us, even when we put it through these very extreme behaviors. It still keeps working for us, hence why it turns on these compensatory behaviors in order to preserve energy and keep us moving. Like, we are really quite incredible. And I always think people take it for granted how amazing their bodies are. And if we actually respected our bodies, if we actually learned to nurture them and respond to them when they ask for what they need, then actually we probably wouldn't have quite so many ailments and illnesses and problems. But we're not taught that, are we? We're constantly being given false information. We're constantly being, everything is becoming digitalized. Everything is becoming monitored by tech. And I find it fascinating, because I just think actually the best source of monitoring is ourselves. Our body knows what it needs and it knows what it wants.
Yeah. It's just a matter of listening to it.
Mm-hmm. Yeah. And I think, often people say, oh, you're so lucky, you seem to always stay the same. And I was like, I'm not lucky. I just listen to my body and it regulates. Like, if I'm hungry, I eat. If I'm not hungry, I don't eat. If I want something, then I allow myself to have it, because I know it's going to make my brain feel good. Like, I think it's not luck. It's that internal regulatory system that I've become very good at listening to and responding to. And yes, it takes time, but I think people who are naturally lean, as or people who always stay the same, whether they're lean or not, it doesn't matter. They always stay around the same. It's not that they're lucky and they're genetically gifted in some way. It's because they listen, and I think that's often missed.
Yeah, I would agree with that, because of, especially now with social media, there's so much, and everybody wants, well, let me get on this train for a little while. Let me get on this train, instead of just being their own train and just listening.
Yeah, exactly. Yeah, totally. And social media definitely, well, it creates all sorts of senses of unworthiness, competitiveness. Like, everybody's got an account to a certain degree, has a brand, right? And you're basically trying to promote that brand and sort of showcase your brand as being the best brand out there. And I think that's problematic, because you're always setting yourself up to compete, and I don't think that's particularly healthy.
Yeah. Clearly it's becoming a problem. I mean, with all of the things that we're seeing happening to people's bodies because they're trying so many different things, and it's just becoming exhausting to our bodies.
It's interesting. I read somewhere, I think I can't remember. I think it was a book. It was maybe a book about psychology or something like that, and it basically was saying how if we all just stopped trying to fix ourselves, we'd actually probably be okay. But we spend so much time trying to fix ourselves, trying to be versions of ourselves we perceive we need to be accepted, that actually in the process of fixing ourselves, we take ourselves further and further and further away from who we truly are. And I thought that was really, for me, that was really poignant.
Yeah. Yes. Very. Wow. Something for us all to think about. Is there any question that I haven't asked about REDS or rhabdo or any eating disorder or perimenopause or something that I've missed that you would like the audience to know?
So I think we've done a pretty good whistle stop tour of it all, to be honest. I think it's been a really, I mean, I think, I don't want to scare everybody out there. I do want people to know that you can recover and you can have a really healthy life. And I've worked with a lot of people where, they now have a really healthy relationship with food and exercise, and they're living very, very rich lives that they can enjoy. But I think the bit that most people don't appreciate is that REDS is more than a physical condition. There's definitely a mindset behavior shift that also needs to happen alongside it. And I think some people are quite resistant to that. So, yeah, it's like I said, it's not quite as simple as just eat more and do less. It's way more involved.
Yeah. Well, hopefully, the audience will take heed of that, and people will get the help they need. And I had the pleasure of hearing you speak about REDS on a different podcast, so I'm glad that the word is getting out there. I wanted to make sure my listeners, could get this information and kind of check themselves, kind of ask some deep internal questions of, do I fall into this category?
Yeah,
so
no,
I really appreciate.
Yeah, no, thank you so much. And actually, it's been interesting. Like I've done a lot of podcasts over the years, but I have done a lot of US podcasts this year. So obviously word is spreading across the pond, which is nice to know.
Yes. And I really appreciate the time of evening that you are joining me. And so I appreciate you being here and taking time out of your busy schedule to give us this information. It's very helpful.
Oh, it's my absolute pleasure. It's lovely to chat with you. And thank you so much for what you do.
Yeah, my pleasure. Thank you so much for being with me. All right. Bye-bye.
Bye-bye.
Wow, what a recording, right? Wasn't that some great information? So Renee's book, Fuel for Thought, is the one that she most recently created, and you can get it on audio as well. There will be some links and the list in the show notes if you want to pursue any of the information a little bit further. So I hope you all enjoyed that. Again, please reach out to me at carla@coffeecrewcoaching.com. Follow, share, and rate the program. If there's someone that needs to hear this information, please share that with them. And we'll look forward to seeing you on the next one.